So thank you, Senator Johnson and Mr. Chair. A recent New York Times article caught my attention. The article was entitled, "A Huge Threat to the U.S. Budget Has Receded and No One is Sure Why." I'd like to introduce that New York Times article for the record, Mr. Chair. The article outlines that since 2010, Medicare spending has been significantly lower than expected. According to the CBO, between 2010 and 2020, that cost was about 9% lower than what they had expected. And the most interesting part is that nobody's 100% sure why. Is it a combination of legislative changes, new laws, economic changes, technical changes, which CBO estimated led to some past overestimation of spending per beneficiary? And the majority of the decrease has come in this category, less spending per beneficiary. I'd like to understand a little bit more about this. I wonder whether the passage of the Affordable Care Act and the extension of health insurance to working Americans in the millions who had never had insurance before might have led them to live healthier and thus need less health care immediately upon obtaining Medicare eligibility age. But Dr. Moon, might you speak to that trend and offer any thoughts that you have about why Medicare spending over the last decade was lower than expected?
Sure. I agree that we don't know exactly, and it's very hard to parse it out. But we do know, for example, from studies that have been done of people who come onto the Medicare program when they did not have insurance before they came on, they spent much more in the first few years, and it lasted for a number of years than other beneficiaries who had insurance. So undoubtedly, the Affordable Care Act will have had a very large impact, and I think there'll be eventually studies that show some of that. The other thing that people don't focus on so much is that that also is a period of time when the baby boom generation was first becoming eligible for Medicare, and 65-year-olds are much cheaper to provide care for than 85-year-olds. And when we baby boomers, I as one, get a little older, we'll be adding to the cost. So some of that may not stick. I think we're also finding some ways in which people are a little more skeptical and concerned about their care and asking better questions. Some of that, as people were talking about competition, some of that may help. But I'm also a skeptic that we have a system that's very receptive to people making good choices. Mm-hmm. This is really important stuff to people. They don't want to mess around. They're not going to go out and shop 14 different MRIs before they choose which one they're going to get, et cetera. We're going to have a real difficulty wrestling this to the ground, and I think this is going to have to take concerted effort of more consumer information, better investment in providing that information to people so they can make good choices, but also better government controls and insight into how we manage this very cumbersome but important system.
Well, there is an overlap in your comment and what Senator Johnson was saying, a market where people don't know what the costs are or shopping for the price of 14 different MRIs to decide which one to take is not the way people will approach their healthcare choices. We've got to figure out a way, more information, more transparency. I think all can agree on that. Ms. Wong, I want to ask you a question. Your testimony describes how the wealthy can often structure their affairs to choose their tax rates and when, even if ever, their income is taxed. I'm a co-sponsor of a bill by Senator Baldwin. It's called the Carried Interest Fairness Act, and that would address this issue, at least with respect to closing the carried interest loophole. Could you describe how reforms in this space could help address the two-tier tax system that you described?
Thank you, Senator. It's a really great example of how preferences in the tax system sort of attract avoidance and sometimes even evasion in complex ways. So the carried interest loophole, as you know, is how some hedge fund managers can choose capital gains treatment on compensation that should really be taxed as salaries. In other words, they can just elect to have a lot of their income taxed at a lower rate. So closing this loophole would just mean that the labour of fund managers would be taxed similarly to workers who are employed at the same companies that these hedge fund managers are investing in. And the 2017 tax law did take a small step towards addressing this issue, but bills like yours and others would more comprehensively close the loophole.
I'm very much a believer that we ought to move to a system where income is income. I would want it to be progressive with rates that would be higher as income goes up, but a system that would not advantage structuring your income as, capital gains rather than salary, or carried interest rather than salary, or interest rather than dividends. You know, we just give people who have the ability to hire sharp accountants and lawyers the ability to, you know, essentially choose their own tax rate. Most people don't get that deal, and we should move to a system, and that would be more fair. And it would be one way we could also address some issues like the solvency and funding solvency of programs like Medicare, really important. As I yield back, I am really intrigued with this Medicare cost issue. And as you said, Dr. Moon, even though this particular question about ACA expansion and connection of Medicare costs, there may not be enough data yet, there has been significant studies about the Medicare spending per beneficiary of people who had health insurance before they reached Medicare age and those who didn't. And just the healthier you can keep yourself during in life, the healthier you're going to be when you reach Medicare age. And if you don't have access to good health care or health insurance, you're going to have a lot of deferred maintenance on the body when you get to Medicare, and that will drive costs up. And so I think if the past studies hold, I think we would likely see that the expansion of affordable health insurance, both through Medicaid expansion, but also just providing subsidies so that people can buy insurance on the exchange at a lower cost rate, that expansion is going to be a significant factor in the reduction over what we might have expected in Medicare per beneficiary costs. So I look forward to more discussion on that. And with that, Mr. Chair, I yield back.
Thanks, Senator Kaine. Let me thank the witnesses for appearing before the committee today and for the many colleagues who participated. Let me also thank the advocates and the District of Columbia seniors who joined us here in the hearing today. Appreciate very much your presence. I would say that perhaps some faint outlines